Hi, welcome everyone. We are admitting everyone now and we'll start in a couple of minutes. Thanks. No, no, I'll just decrease the volume, the phone, the computer volume. I'll just reduce that. No, no, I'll just say your names, then I'll hand it over to Sendo, and then you guys will introduce yourselves. She'll load over there. Yeah, but you guys will introduce yourselves and tell it. Prepared, that's good. You'll know what to say when it comes. Okay. Yeah, yeah. Um, Good afternoon, everyone, and happy Mother's Day to all of you. Thanks to all of you who could take our time to join us today. My name is Puneet Singh, and I am a volunteer with HPN and Friends of India. I'd like to briefly acknowledge the plight of COVID 19 in India. It just breaks our hearts to see what is happening to our brothers and sisters back at home. We are deeply saddened by such a turn of events. With all your support, we've started to provide direct help to our community back in India, and we will share the details of that towards the end of the presentation. All right, today's topic is diabetes, and this discussion on one of the most prevalent illnesses in Indian community is brought to you by Health Professionals Network and Friends of India. As we all are aware, there is an increase in intake of high sugar foods, processed foods, which are heavily loaded with preservatives. As a result, amongst other health problems, we all are at a high risk of developing type 2 diabetes. And if you're from Indian ethnic background, this risk increases significantly. But as these experts here say, that being a diabetic is not the end of the world. So they're here with us and they'll give us a few simple tips and few simple changes that you can make to your lifestyle and appropriate interventions that you can go with to manage your diabetes and live a normal, happy, and fulfilling life. If you have any questions while the discussion is still on, please put your questions in the chat box and they'll be addressed towards the end of the discussion. Our panel today includes an endocrinologist, Dr. Nandini Shankar Narayana, a general practitioner, Sendhu Ravana, she'll join us in a bit, and a dietitian and diabetes educator, uh, Susan Lopez. And now I give it to Sendhu. Thanks.
Thank you, Puneet. So let's begin. To begin with, I'm going to give you an overview on diabetes. Can I get this first slide on? Thanks. Okay, so before we start, I'm going to share a small experience that I had when I was preparing for this presentation. I was doing my slides. And my 8-year-old son had a look at this. And he went, I know what diabetes is. It means you can't stop going to the toilet. Yeah, well, I didn't teach him this. He learned it from a TV show that he was watching at that time. So then, can I go to the next slide? So later, I figured out the term diabetes, which was coined by this great Greek physician, literally meant to pass through. So then the word mellitus was added later on, which meant honeyed in Greek. So that's how we got this clinical term, diabetes mellitus. In fact, in India, ancient Indian physicians um, has described this condition well before Greeks, and a similar term, which is madhumeha. So I thought it's interesting, and yeah, so I wanted to share this here. So with the advances in science, we know a lot more about diabetes. So today we describe diabetes as a chronic health condition that affects the way the body processes blood sugar. So in other words, blood glucose. So this causes people to have too much of glucose in their blood. But we need glucose. That's our main source of energy, especially for our brains. So we get glucose when we eat carbohydrate rich food. So yeah, we to help convert this glucose into energy, we also need this hormone called insulin. So let's see what goes on in our body when we have diabetes. So in a healthy person, when he or she eats a carbohydrate food, it's broken down into glucose molecules in our gut. So this is then absorbed into our bloodstream. So can I go back to the original slide, please? So it's then get absorbed into the bloodstream. So when the blood glucose level goes up, it signals the pancreas to release the right amount of insulin. So the insulin then acts as a key and opens these gates in the body cells and lets this blood glucose in. So in the cells, the sugar, this glucose undergo further chemical processing and it's converted into energy molecules. Um, for someone with diabetes, this process doesn't work properly, either because they don't make enough insulin or the insulin that's there, it's not working that effectively. So they end up having too much of blood sugar in their blood. Um, so this too much of sugar in the blood can cause lots of different problems. To begin with, it can cause some of the diabetes symptoms. Can I go to the next slide? So you might have seen people with diabetes tend to wake up several times during the night to empty their bladder. So they tend to wee a lot. So they feel excessively thirsty. They feel tired for no reason. Some might experience weight loss, frequent infections like thrush, and suffer from slow wound healing. So majority of the time, diabetes don't cause type 2 diabetes especially don't cause any symptoms, so it's important to remember that. Yeah, if we leave this blood glucose to remain high for a long period of time, it can cause it can damage the blood vessels in the body and cause what's called diabetes related complications such as heart disease, stroke, kidney disease, poor circulation, nerve problem, and blindness. But the good news is, with the early diagnosis and right treatment, these complications can be prevented. So yeah, coming to the types of diabetes, there are lots of different types of diabetes, but the main ones are type 1 and type 2. So I'll come to that when we answer these questions and explain a bit more about these types. So now Dr. Nandini is going to discuss about prediabetes.
Thank you, Sindhu. So, what is prediabetes? Here, the blood glucose is higher than normal, but it is not high enough to fall into the diagnostic criteria required for type 2 diabetes. So, um, usually this is asymptomatic. We get to know because someone measured your blood glucose. This is a signal to say that your pancreas is struggling to keep blood glucose within a normal, healthy range. So it would be on an overdrive, but it is like being able to look into the crystal ball and predict your future. So this gives you the window of opportunity to intervene. It's the golden chance to make a meaningful lifestyle change. By lifestyle change, I always mean diet and exercise together and take control of your life. before there is full blown diabetes and also to prevent further complications. Next. So, why should we worry about prediabetes? Because there are no signs or symptoms. As I said earlier, we only know because someone has measured the blood glucose and found it to be abnormal. So, it could be a high fasting sugar or a high sugar after a glucose load on a diagnostic test. Not everyone with prediabetes will progress to have diabetes, but there is certainly high risk of developing type 2 diabetes by about 10 to 20 times compared to someone with normal blood glucose level. And there is also increased risk of heart problems and circulatory problems. But as I said earlier, this is the window of opportunity to treat by lifestyle changes with diet, regular exercise, and weight loss. Without these lifestyle changes, one in three people will progress to develop full blown diabetes. Next slide, please. So, what are the risk factors? Size definitely matters, and the people from subcontinental origin tend to carry higher upper body fat compared to the lower body. So the guidelines are set at a lower target for our population. So we define being overweight as someone with a BMI more than 23 kilograms per meter square, where it is 25 for the Caucasian population. Similarly, the waist circumference, as I said earlier, we tend to carry more fat around the tummy, so is set at a low range, more than 90 for men and 80 for women in the Indian population. Next slide, please. So continuing the risk factors, so you're at more risk if you have a very inactive life, if you're sitting down for long hours, if there is family history of diabetes, and we groups the biological and the biochemistry together to call metabolic syndrome, where there is high cholesterol, high blood pressure, and high blood glucose. So one of the other two, you could still be at risk of developing diabetes. And if you are a lady with known to have polycystic ovarian syndrome or history of diabetes in pregnancy or gestational diabetes, and as we all know, coming from the subcontinental origin, we are at increased risk. Next slide, please. So, how do we treat prediabetes? I can't stress enough about the importance of lifestyle changes here. There is very little evidence for pharmacological treatment, but this is always done after having tried all lifestyle measures. So, our dietitian on the panel here, Susan, will be talking about diet later. So, by exercise, I mean at least 30 minutes of moderate intensity exercise every day. This could be walking. If you're counting steps, at least 10,000 steps a day, and about 20 minutes of high intensity cardio type of exercises at least 2 to 3 times per week. If you are keen, you can include resistance training. When these have failed, and if you are still at a very high risk category person, you may need help with uh, tablets or injections for weight loss. And when everything fails, surgery may be needed to alter the stomach size, but I'm not going into details of these procedures in this talk. And the treatment will also include addressing other issues such as high blood pressure and high cholesterol.
So thanks, Nandini. So Dr. Nandini said intense lifestyle modification will help prevent type 2 diabetes if you have pre-diabetes. So Susan will give you, will introduce you to the diabetes prevention program that we have in New South Wales, which is Get Healthy Service and Beat It program. Can you, Susan, can you please talk about these programs? Thanks.
Thank you, Sindhu. Yes, so as Sindhu and Nandini were pointing out, um, when you think of pre-diabetes, it is at a preventable stage, and that's really important to understand. So, and when you look at, different campaigns out there, or opportunities which you can avail, the simplest would be two of them. One is the Get Healthy New South Wales, which I'm going to just slightly go through. It's very easy to enroll into Get Healthy New South Wales. You have the contact details there on the slide. You don't really need any particulars as such to get enrolled. You just go on to them, go on to the sheet and put in your details. And the goal would be to really get help over a period of time through telephone sessions. So you get calls from uh, different health professionals, and they speak to you over a period of 6 months, and it's 13 phone calls, free of cost. So there's no cost to this. It helps with, say, suppose, and the beauty of this is this was there even before the telehealth and the COVID and things. We've had the Get Healthy New South Wales for years before telehealth even started last year here. um, and so you get different input. Say, suppose you speak to the dietitian, they will ask you, okay, how was your previous week? What are your goals? How are you planning to eat well? These are the methods you can choose for eating well. And they will monitor you again after a few weeks. And similarly, a psychologist, you can choose who you want to speak to. A psychologist with, say, with goal setting, with achieving goals, with not being able to achieve goals, and also with an exercise physiologist. So there, who will speak about what are the simplest methods of exercise which you can choose for just getting healthy. So for pre-diabetes and type 2, um, these are important because accountability and knowing that someone will call you to see how you're going can make a huge difference in knowing that you're not alone. Okay, so the next slide, please. Uh, the other really good program, and I think this is a really popular one, it's called the Beat It program. Now, this is a program which includes 8 consecutive weeks of group exercises. For this, you will need your GP to sign the form, and you send it across to them, using the website there. And so it's meant for people with chronic disease, and of course diabetes being an important chronic disease, you will definitely be able to qualify for it. Again, free to access. It's just a matter of you doing it. It's don't procrastinate. Don't think, oh, you know what, winter is coming, it's cold, it's raining, no excuses. Because with these programs, it's just a matter of, okay, these are 8 consecutive weeks. If you read what they say there, you should not be missing a week, meaning that they really will ensure that you are making this a habit. And therefore, again, I would push you to try these programs, and get support which is already there. You just need to reach for it. Okay, the next slide, please. Yeah, so this is different. So the NDSS is the National Diabetes Services Scheme, and it's a it's a big body. I think with that many people in Australia having diabetes, you can imagine how many participants there are. So most people with diabetes are encouraged to become members. It helps with many things. It, again, free to register. You need your GP or your diabetes educator to sign the registration form, which is sent through the pharmacy. And the NDSS gives you, a, a cheaper access to testing if you have a glucometer, because strips, people make the excuse of, not really excuse, for some it's a genuine thing that, okay, it is too expensive, but with the NDSS it's more affordable, and therefore is a real help and necessity for someone with diabetes to be a member. Apart from just getting free access to needles, you have excellent programs which they have right through the year. So if you go on to their website, you'll see that there is a calendar of events. You put in your postcode, and they're for different say, for your healthy eating, regarding taking care of your feet, exercise, label reading, how to use your glucometer, how to help your glucometer help you. So how to understand diabetes. So, and the again, the thing is, these are group programs. I think they have around less than 10 maybe participants per group. And therefore you get to meet others who have the same difficulty as you are having. And it helps you with just that wanting to look after your health, knowing that okay, it is possible to do so, just like the other people in the group. Okay, so I'll give it back to
Yeah.
Cindy.
Thanks, Susan. Just to clarify there, so for people with at risk, I mean pre-diabetes,
Yes.
they can go on to do get healthy and eat it
Of
program.
course, yes, yes. Yeah.
So, but for someone who has already been diagnosed with diabetes, they
Yes, yeah,
sign up
that's
for
correct.
NDSS for support.
Yes, yeah,
Yeah,
yeah. So pre-diabetes is
yeah,
mostly just making use of the,
yeah,
as
yeah,
Sindhu was
yeah,
saying, they won't be able to register as such,
yeah.
but they can avail the other services. Yes.
Yes. Okay. Yeah. Thank you. So now I will go to the diabetes diagnosis. Can I go to the next slide? So how do we diagnose diabetes? So you got to have a proper blood test uh, uh, to diagnose diabetes. Just it not just the finger prick test that you have. So we use three different kinds of blood tests to diagnose diabetes. One is the fasting BSL, HbA1c, and oral glucose tolerance test. Commonly, we just use either fasting or HbA1c. But if your blood sugar is borderline, then you might have to do this special test, which is called oral glucose tolerance test. So this will tell us if your blood sugar is normal or if you have impaired glucose tolerance, in other words, pre-diabetes, or you have diabetes. And we also use this test in the context of pregnancy to diagnose diabetes. So these are the tests. So if you someone has asked this question, how frequently you need to have the blood test? So if you're of Indian origin and if you're 18 and above, you could see a GP who could do a risk assessment. We use a risk assessment tool to calculate your risk score. So if your score is 12 and above, you're considered as high risk, and then we'll get you to do blood test for diabetes every 3 years. But if you have pre-diabetes, you might have to do it every year. Um, but what I would say is if you're 35 and you're Indian, just do the blood test every 3 years just to screen for diabetes. Um, but yeah, that question is like if you're asking if you have already have diabetes, how often you have to have a blood test? That the answer is every 3 to 6 months. Yeah, can I go to the next slide? Yeah, now I just wanted to touch base on annual cycle of care. Before that, I just wanted to discuss diabetes management in general. So, with diabetes management, the goal is to prevent diabetes related complications. To prevent complications, we have to keep our blood sugar within normal range. So, to do this, you have to take your medications, eat healthy, and exercise, as Nandini and Susan has been telling. So what's equally important is you have to have regular checks to check your heart, kidney, eye, and foot, because diabetes could be causing damage without you having any obvious symptoms. So you shouldn't wait for something to go wrong. So there's a lot of different checks that you have to do. You, how do you keep track of all this? That's when your annual cycle of care will um, come in handy. So this gives you a checklist on the the things that you need to be having. So annual cycle of care is a special diabetes health check that you do with your GP every year. So by this you can plan your diabetes care for the year. So what happens with the during this annual cycle of care is you see your GP, they'll talk to you about your diabetes control, they'll discuss the medications you're on, and discuss your health in general. They'll also check your blood pressure. They'll do a blood test to check your kidneys, cholesterol, and of course the sugar level. And they'll organize a referral to see for you to see your podiatrist and your optometrist. Depending upon how you're going with your diabetes control, you might have to see your dietitian, diabetes educator, and exercise physiologist. So you might be wondering, with all these additional referrals, there's extra cost. But if you have diabetes, your GP can do a chronic disease management plan. This will allow you to access up to 5 allied health services under Medicare. So talk to your DP about doing this chronic disease management plan. And also I wanted to tell you, like, if you have been struggling with your diabetes management, you can also see your psychologist. Your GP can do a mental health plan and get you to see a psychologist. So we are lucky here in this country. We have all these services and support. So we should be making use of this to help manage our diabetes better. Um, yeah, so I'm now going to ask Nandini to go through the medications. Thanks.
Thank you, Sindhu. Oh, was there something more you wanted to say?
No, no, no.
No. Okay. Next slide, please. If you can.
I think we'll get we arrange the slide so that yeah, we'll get Susan to talk about diet, and then Nandini will talk about medication.
Uh, Yeah, so I'm just going through to go through the diet for diabetes. And yeah, this initial slide is very similar to Sindhu's, just a simple indication that, when you have diabetes, that the glucose is not being, it's going to get collected in your blood because there's not sufficient insulin, and therefore the diet will need to be given a lot of attention. I'll just go to the next slide. Thanks. Yeah, so there is no real special diet for diabetes. There is just a reminder, uh, to eat well. So if you look at the Australian Guide to Healthy Eating, it points out to different food groups. So include a balance of different food groups, ensuring that there is sufficient vegetables, um, uh, and a couple of fruits a day. With dairy foods, make sure that they're light, and choose mostly milk and yogurt as opposed to cheese among the dairy foods. With protein foods, choose lean meat, lean chicken, fish, lentils, legumes, nuts, eggs. Okay, so and of course, in you can see the plate over here suggests that it has to be in certain amounts. So where you have lots of vegetables, a few fruits. A balance of different types of proteins through the week, and with grain foods, I would want to go more specifically into it later. However, before I do that, just reminding that other things to remember is all those yummy things, the jalebis, the donuts, and I'm sure on Mother's Day there's a few things happening with sweets and things. Yeah, so those are. Uh, okay, can you hear me? Sorry, there was some trouble here, some technical trouble, not real trouble. Okay, so okay, so just going back to the guidelines here. And the other, so yeah, don't really overdo sweet foods and cakes and lollies and nice samosas and pakodas which are deep fried. And on the other side, there's also a mention of fats. So fats which are good fats are important, like avocados, nuts, a little bit of oil. Choose good oils like olive oil. Keep away from using too much ghee and coconut, because those are saturated fats and are can increase your cholesterol. Yeah, I'll just go to the next slide. There is another slide just before that. Okay, that's all right. I think I have missed a slide. I'll just speak about it. Okay, so there is something called glycemic index, which is important to understand. Glycemic index is actually how quickly or slowly a carbohydrate food is absorbed into your bloodstream, therefore increasing blood glucose levels. And because of diabetes, we need foods which are slowly absorbed, or they're called low GI foods. There is a high GI foods mean that your sugar levels are going to spike as soon as you have those foods. And you, with diabetes, we don't want blood glucose levels spiking. You want a stable management of the sugars through the day. And yeah, so with what are low GI foods? Over here in this slide, it first talks about what are carbohydrates. So in general, carbohydrates come from many different foods. So there are grain foods like rice, lentils, bread, chapatis, pasta. Then there's dairy foods, which is milk and yogurt. Cheese does not give carbohydrate. Then you have the starchy vegetables, which is potato, sweet potato. Then say if it is cassava, yam, and you also and corn, of course. And you have fruits and fruit juice also being sources of carbohydrate. On the lower part of this list, you can see that there are very sweet foods, or things like ice cream. So they are also carbohydrates, but the ones on the higher part of the slide are healthier than the ones on the lower part. I'll just go to the next slide, please. Um, so this slide just tells you which are the foods which don't contain or have very little carbohydrates, and that's mainly non-starchy vegetables. So everything excluding the potato and corn and sweet potato, in other words. And then you have protein foods excluding lentils. That means so there's meat, chicken, fish, eggs, and tofu. And you also have unsweetened condiments, herbs, and things which don't have carbohydrate. Yeah, so this is a graph which I thought I had missed. So yes, so it shows you the spike from high GI foods, and we don't want that. We want the low GI foods being included regularly. uh, so the next slide, I've just put that out there mainly because this is regarding our yummy foods, our Indian foods. And yeah, except for the bread and the rolled oats, of course, everything else is something I'm sure which we all love to have often. Yeah, so see, with low GI foods, we think of how do I make my foods get absorbed slower. Okay, so by regularly including rolled oats, by regularly including multigrain bread, yes, you're doing so. But and with our Indian foods, it's possible with say the basin chilla, so that the we see that in inclusion of fiber, protein, and fats lower the or slow down the absorption of foods. And therefore the basin being a source of protein is going to be a better example for diabetes than just say a plain naan as such. Okay, and that little column there is we call it paniyaram. I'm not sure in Kannada what do you all call it. What is that? Okay, okay. So we'll call it paniyaram for today. Okay. So the I mean I've just put that there because that can be made in many different forms, but that's a healthier version where rolled oats has been added into the batter along with the rava, which is semolina, some carrots, and so it's going to be a much healthier snack than if you were just going to use say plain flour without anything else other than just flavors added. the chutney there, how is it made healthier is instead of using coconut, almond flour has been used for grinding it. And of course that doesn't have anything in context with the GI, but why I put it there is like, see, if you're having dosa, you have it with a healthy chutney. Okay, because otherwise it's not only about GI that you worry, it is about glycemic index in combination with other factors. So the dosa there is a very unusual dosa, although it looks normal. It's not. It's a tofu dosa. So I've blended tofu in that. And added a little bit of rava and onion. So you can make, in other words, Indian recipes. If you incorporate, again, in the vegetable upma, there's veggies in there, there's rava in there. By incorporating protein, fiber, and healthy fats, you're slowing down the absorption, and it's a very practical method of still being able to enjoy those favorite foods. Okay, so I'll just go to the next slide. Okay, now coming to how much of these foods should we have. So the guidelines for healthy eating is that the carbohydrate, which is slowly absorbed, should be a quarter of the plate. And why I put the picture down below, I know it's very unclear, but the second one is rice, or is it from my side? Maybe okay. Yeah, the one which looks the least is rice, showing how starchy it is, and the one which is just on the side where it is the really darkened one, that's actually lentils. I think it's rajma. Okay, just to understand that if you're going to have both of them together, like which we typically do in our Indian diet, we have rice and chana, or we'll have sambar and rice, and of course we'll have even buttermilk with it, some yogurt with it, and our diets are very loaded in carbohydrates. So it is important to understand that whatever you're including there should be within the quarter of the plate. If it is mostly lentils, less rice, you can go to one third, but otherwise just stick to a quarter. And in the vegetable part, it's best to leave out potato, or if you're including, then leave out dal. Like I would advise in our Indian diets to choose two carbohydrates at the most per plate, but not, we easily do three or four. If you look at our Indian diets, there's usually potato, rice, then dal and raita and things all together on one plate. So it's important to just understand what are the carbohydrates and which two can I have. Two is an example. Okay, so and the other quarter is protein, which is meat or chicken or fish, or it could be lentils or tofu. Okay, so I'll just go to the next slide. Yeah, so that's the same. I mean, same thing in real life actually. You can see that the quarter of the carbohydrates here is coming from a small roti and half a cup of rice, and the vegetables, which are non-starchy, are occupying a half of the plate from two different sources, and the other quarter is chicken. Which Yeah, so it's just making sure that you're having a balance of foods, and you're not going to feel hungry if you're ensuring that there is sufficient vegetables. If you only think of, oh, that's all I can have with the rice, then you're going to feel hungry, but increase your veggies. Okay, so, and that's just another plate where half of the plate is vegetables which are non-starchy, that's cauliflower and beans, then the other quarter is meat, uh, um, uh, or chicken, and the other quarter is rice. The next plate is a vegetarian plate, which I thought would be quite important to discuss. So here you can see that it looks more than a quarter, and that's mainly because it's mostly chickpeas, less rice. So it's around a third of the plate of carbohydrates. And Because chickpeas give you less carbohydrates than rice, and that's why you can have it just little bit more. Uh, the veggies are non-starchy and should definitely occupy half a plate. I actually showed this plate to a patient on Friday, and I said, okay, so this is how your plate should look if you are a vegetarian. He was a vegetarian and Indian patient, and so I said, okay, this is how your plate should look if you are trying to cut down your carbohydrates. And he said, but where's the rice? Okay, so that really sums it up. For us, we're so used to seeing more of rice or more of chapatis that it is important to understand that yes, I can see the rice, it is still there, but it shouldn't be occupying as much. Okay, so at the next slide. Yes, and all this is important in a busy lifestyle. Okay, we have so many patients who come and say, okay, I'm doing all these things, but my sugars are still high. So the question to ask is, Are you eating on time? Are you having regular meals? Are you too busy? Okay, and so the importance of regular meals is there. Include three main meals. Don't skip your breakfast. Include a fruit or a glass of milk or some nuts between meals. If you are on insulin, then the importance of the snack. Anything with your diet should be discussed in detail with your dietitian. It's very hard to generalize on a talk like this. So these are just general guidelines. Okay, the next one, slide. And yeah, so with the food, so exercise is important because when you exercise, your body is using the sugars which you have eaten. And with diabetes, we see that after meals is the best time to be doing your exercise. Anytime after meals, just not before breakfast is the general recommendation. And whether it is running, whether it is weights, we do see a lot of benefit from resistance training. And where you're also using your glucometer to understand what's happening when I'm exercising. The same meal with exercise, test your sugar 2 hours after eating, and compare it to if you hadn't exercised on another day. You'll see that you'll understand your diabetes better. Your glucometer will tell you that when you walk, you're doing well, or when you exercise, you're doing well. And yes, test your sugars. It helps with keeping on track. We don't really advise too much of testing if you have pre-diabetes, but if you have type 2, yes, you need to, just be aware of what numbers are you waking up with. What are the numbers 2 hours after dinner? Write it down in a book. And yeah, that's just the flash glucose monitoring, which people now like. If they're on if they even if you're having type 2 diabetes but on insulin, you can get those, the way you scan and get the reading as opposed to testing. But the testing methods, using your finger prick methods, are the most accurate. Useful apps, so I thought I'll just you can go through this later when you get access to the slides. Among these, I have a mind block with apps, especially the carbohydrate counting ones. So my advice there is, first discuss with your dietitian, okay, how much should I eat? And let them help you with what are the carbohydrates, how much and when to eat. And once you have understood it, then you could probably refer to a carbohydrate counting app. Don't let your app teach you, because your app will designate, okay, you know what, this is how much carbohydrate you need per day. But that's may not be true, because it's different for people of different ages and exercise levels. The one Sorry, yeah, I'll just go to the next slide actually. So this one is the question which we get bombarded with. What is the role of a low carb diet in type 2 diabetes management? Yeah, so see, the low carb diet is not an easy diet to follow. I've put a position statement from the Diabetes Australia here, so you can refer more to it once we finish. But the low carb diet is a very restrictive diet. It's not easy to follow. If you look at how many grams it actually is, it means that you are not getting necessary and sufficient fuels. And okay, understood, if diabetes were going to go away in, say, 2 months, okay, you can follow it. But this is a lifelong condition. So the question to ask yourself is, will I be able to follow this for my whole life? And while I'm following it, will I be able to tolerate the unpleasant side effects? Example, low carb diets are associated with feeling grumpy, constipation, uh, then a high risk of kidney disease and heart disease if you're going to be depending on too much protein, too much fats. And so I would advise against it. A moderate carbohydrate diet or lower carbohydrate diet would be better. Okay, and that's just the last link there. I thought I'll just put some really useful websites for diabetes friendly recipes. I would recommend really the one in the middle. So we have Raji Jaydev, one of our dear dietitians here in the group, and she's developed some really nice Indian recipes. And you can even see the amount of carbohydrates per recipe. The other two are you know just the local national diabetes. The first one is a private one, but it's called healthyfood.com, but it's done by dietitians actually. And you just go onto diabetes friendly recipes, and then you can access quite a few. Thank you. Thanks.
Yeah, thanks, Susan. So it's good that you clarified that doubt. So with diabetes, so you just follow uh, healthy eating like
Yes.
anyone else. No need to be on any special diet because that's sustainable. That's not sustainable over a long period of time. So we are running short of time, so we'll go to some of the audience questions. So one of the question was on medication. So I'm diagnosed with type 2 diabetes. Currently, I'm taking Diabex 1000 milligram twice a day. How long should I take this medication and what are the side effects? Dr. Nandini is going to answer this for us.
Yeah. Thanks, Indu. Sorry, I'll have the slides up. I just wanted to emphasize that whatever treatment you are on, the lifestyle measure, diet and exercise applies at all stages, whether you're on tablets or any forms of injectables which are not insulin or insulin. So this is applicable to everyone. If I could go to the next slide, please, just to answer this question. So the question was about someone who is on metformin. So this is one of the most commonly used drugs in diabetes treatment. It acts by reducing the amount of glucose that gets released by your liver. It also helps with your weight. But the question said, how long do I use this for? Diabetes treatment is not a short-term treatment. You can't take tablets like a course of antibiotics that you would be taking for an infection. So this, unless you do something drastic, you have to be losing at least 10% of your body weight to see a um, metabolic response, a difference in your blood sugars. So when you do such things, you may be able to come off medications for some time, so you can be in remission, you can delay the progression. But most people do need this long term. So the answer to that is it is long-term medication, and the most common side effects are bloating and diarrhea, but they usually tend to settle with time. So we just tell people to stick on. If you're not able to tolerate, talk to your doctor. They can probably change to something else.
So yeah, metformin is very well tolerated, and we've been using metformin for many years. So that's good. So the next question on the medication is uh, about the newer ones. So how safe are these new medications? That's in particular the once a week injections like Bydureon and Trulicity.
Thank you. Sorry, I'll need my slides back again. So these drugs are relatively new, but there has been extensive studies. They're very safe. Next one, please. Next slide. One after. Okay, so they belong to a class called incretin mimetics. So incretin is a hormone that is naturally made in our body in response to a glucose load. We require it to maintain the blood glucose levels in a certain range, and these drugs, um, you know, decrease a hormone called glucagon, which does the opposite effect of what insulin does. It slows down the gastric emptying. So basically, your food tends to stay in your gut for longer time. So you feel full, you feel satisfied after a meal. Um, so yes, it is very helpful in weight loss. Some of the side effects include nausea, vomiting, because the food is staying there for longer. So some people do feel nauseous, but again, they settle with time, and there has been a lot of evidence, so they're certainly safe to use.
Thanks, Nandini. So I'm going to go answer this question, which is on whether diabetes is reversible or whether diabetes can be cured. Before I answer that, I'll just tell you what happens with type 2 diabetes. So initially, it will be the insulin resistance, which means the body's cells are not sensitive enough to the insulin. So insulin can't do its job effectively. So the pancreas tries to compensate for this by producing more and more insulin. So this process goes on for a few years, and then pancreas finally get exhausted and can't make enough insulin. So this, in combination with insulin resistance, makes the blood sugar to go up. So we believe that by the time you're diagnosed with diabetes, you've lost at least 50 to 70% of the insulin producing cells. So once this process has started, it's going to progress, and ultimately pancreas, yeah, you lose more and more insulin producing cells. So initially, by intense lifestyle modification like diet and exercise, you can slow down the process, but ultimately, like most of the patient would end up needing medications and even insulin. So the answer is diabetes at this stage is not curable, but you can slow the progression. But Dr. Nandini talked about pre-diabetes. For example, like if we diagnose you at that stage, the outlook is better. Like with intense lifestyle modification, you can totally prevent diabetes. So yeah, that's. I think we can take up one more question on gestational diabetes because that's important. One more. Oh, okay. Uh, uh, so with gestational diabetes, yes, I'll ask this question to Dr. Nandini. Uh, so the question was, if we had gestational diabetes, is it guaranteed that we will get, I guess they're saying type 2 diabetes at the later age?
Yeah. So about 1 in 2 people, 50% people will develop diabetes. So not everyone will develop diabetes, but it just shows that you are someone who is at increased risk of developing diabetes in future. So you need to be aware of the lifestyle changes that you need to make, and you need regular checkups with your GP to make sure that you have not developed diabetes.
Yeah. So it's not only the women. Sorry, it's not only the women who had type 2 gestational diabetes who will go on to develop type 2. The infants are also at risk of developing type 2 when they get older. So we should consider this as a wake up call and try and eat healthy, exercise, so you can prevent type 2 diabetes in future. And especially, women are at high risk for this. Okay, we have 7 more minutes, so we can take more questions. So, yeah. So, what is the risk for children? Would altering diet early prevent it? So, yeah, I guess if the parents are um, yeah, diabetic, what's the risk for children? Okay, so I'll ask Susan.
Thanks, Sindhu. Uh, so, see, for the past few years, we are seeing type 2 diabetes getting diagnosed at early ages. We are seeing children, adolescents getting diagnosed, and that wasn't there before. So, this is definitely pointing out to diet and, okay, I don't like my vegetables, fussy eating. Okay, okay, if I eat my vegetable, then will I get that? Will I have, can you give me the chocolate after that because I'm still hungry? So, of course, if you're improving dietary habits as a family, then you are, the child is going to be at a lower risk of developing it. So, yes, yeah, there is
Yeah,
a
so
big
it's
role with
better
diet.
to adopt healthy eating very early in life to prevent all these issues later.
Yes, yeah.
Okay, what about sugar intake in children?
Yes, so see, I have two sons who go to high school, and they come back telling me that many children don't bring their lunch boxes to school. So it's just the canteen foods which are depended on. And what are the canteen foods which children have when they are hungry? So it's just going to be high sugar foods, possibly lamingtons, possibly, whatever is nice and sweet and yum because they're kids. And so yeah, a very high sugar intake in children is very much associated, and sugar is addictive. The more you give them, the more they want. So it is important to say no or no, maybe after 2 days. I'm sure my sons are listening and nodding their heads or raising their eyes. Okay.
Yeah, it's better to not buy those
Processed snacks.
confectionery foods,
Yeah.
I guess. So other question here is, please clarify, exercise after meals is preferred. This is contrary to what I have heard.
Yes. So see, exercise before meals is okay if the primary focus is weight loss. Because yes, there is sufficient research to show that yes, exercise before eating may help you with reducing fat stores. However, with diabetes, when you think of what is more important, is weight loss more important than managing my sugar levels? No, it's the other way around. When we eat, our postprandial levels rise, which means the sugar after eating increases. And so when you exercise, you're using some of those stored sugars, and so the blood glucose levels drop. And over a period of time, if you're eating healthy, then weight loss also happens. So it doesn't mean that weight loss doesn't happen if you're eating after meals. It depends on what are you actually eating. Okay, yeah, thank you.
Okay, so yeah, that's thanks, Susan. So we have one more question. So in spite of medication, exercise, and diet, why is my sugar level not coming down?
Okay. So it depends. So sh- on the amount of exercise you're doing and what you're eating. So I hope they both the ticky boxes have been done for doing all the right things. And despite which, if your sugar levels are not coming down, you probably need, if you're not on medications, you probably need medications, or if you're already on medications, you probably need more medications or a different kind of medications. We can customize diabetes treatment very well these days. Although I said your size matters, but one size doesn't fit everyone. So we can personalize care depending on what your risk factors are, what your complications are. So you should be seeing your doctor, and if you're not on treatment, it basically reflects that your pancreas is not able to handle the sugar just with diet and exercise alone if you're not on treatment.
So if they're already being on medication, so that needs to be reviewed so that
Yes, yeah, it needs to be
yeah,
altered.
we
Yeah,
can help with yeah, diabetes control.
absolutely.
Hmm. Okay. All right. So another question from the audience: any recommended sugar alternatives?
Yes. Yes, so sugar alternatives in limit are okay. Just reminding you before I tell you what are the better ones, or what are the recommended ones, because in excess they can cause diarrhea, they can have unpleasant side effects like bloating, and there's not sufficient long-term studies with the newer sugar alternatives. But just for knowing, okay, what can I use? You can choose from a wide range. So there is stevia, there's Splenda, Equal, there's the newer one, which is a monk fruit sweetener. I think that one really doesn't have as much of an aftertaste, which other alternative sugars are known for. So, monk fruit sweetener is quite nice in taste, and again, uh, doesn't have any carbohydrates or sugar. So those are the ones which I would discuss, but in limit, though. Thank you.
Okay, so we have time for one more question. Yeah. Um, so, why my blood sugar always high in the morning when I record normal reading before I go to bed?
Okay. So your fasting glucose in the morning is high, but you're sleeping with a normal reading before going to bed. So I don't know what kind of medications you're on or whether on treatment or not. So there is something called dawn phenomenon that happens. So your blood sugars need to be in a certain range for you to be asleep through the night. And as you prepare to wake up, there are a lot of hormones that are in play, and the sugar does go up slightly. So if you have a well functioning pancreas, that will still respond appropriately to keep the blood glucose within normal range. So if you are already on insulin, it is usually the long acting insulin that helps with what we call as your basal levels when you're not eating anything. So the sugar response is, sorry, the insulin response is usually in response to your sugar load or to maintain your sugar when you're not doing anything, when you're inactive. So your basal insulin may not be enough. So that needs to be reviewed.
Yeah, thanks, Nandini. Now we've done with all the questions. I thank you all for making it to this event. Um, yeah, I'll wait for Rajiv to say thanks. Oh, okay. Sorry, I forgot. We'll just play a small video on. This is one of the patient um, who has told her story about how she went with her diagnosis and how she got her diagnosis. Thanks.
Hello, everyone. I'm Titi Zachariah, and I'm honored to have this opportunity to share with you my journey with managing diabetes.
This is on mute.
I've really understood the value of having a connect and a relationship with your local GP. I was diagnosed with type 2 diabetes in June 2019, almost 2 years ago. It was devastating. I couldn't believe it, but I'm thankful that it was picked up when it was, and I could discuss with my doctor and understand what measures I need to take and how do I progress managing type 2 diabetes. So after the diagnosis and engaging with my GP, I consciously was determined to fight it. I was consciously determined to get my life back. So the determination, there were points of defeat. My mind played and fought and battled with many negative thoughts like big deal, nothing's going to happen, or forget it, my life's doomed. But I was determined to make an effort to change things that I was doing, to adapt things that will help me manage this condition. I reached out for help, and I was advised that it would help to increase my metabolism, to help with weight loss and make changes in physical activity. Now, I'm not a gym junkie or a sports star or a runner. What I'd like to do is crazy dancing, and it helped. And slowly, I noticed the weight loss. I noticed a positiveness in my outlook to life. I felt good about myself. I made changes to my diet. I spoke to a dietitian who guided and gave me tips on what I can add, what I can eliminate, what I should increase, made changes and saw more differences in the way I looked, the way I felt, my sugar levels. I got it tested again, went back to my doctor, there was change. So diagnosis, determination, dancing, diet. The fifth D was disclosure. So I had to disclose to people that I was diagnosed with type 2 diabetes. There's a perceived shame initially, but it helped telling them because they become part of my journey in managing it. So, friends, wherever you are in this journey, whether you've been diagnosed or you're pre diabetic or you just want to get a health check done, please start positively. Connect to your GP, make an effort to understand, make an effort to
ಇದೆಲ್ಲ ಮಾಡ್ತಾ
choose
ಇದ್ದಾಗ
a healthy lifestyle.
ಆಯ್ತು ಬಿಡಲ್ಲ ಅನ್ಕೊಂಡು ಹೋಗಿ ಡೇಂಜರ್ ಇದು ಹುಷಾರಾಗಿ ಅಂತ ಕ್ಲೋಸ್ ಹಾಕೊಂಡು ಅದು ಕ್ಲೀನ್ ಮಾಡ್ತಾ ಇದ್ದ ಯಾವ್ದು ಯೂಸ್ ಮಾಡ್ತೀಯ ಅಂತ ಅವ್ನು ಕ್ಯಾಪ್ ಕೊಟ್ಟ ಫುಲ್ ಡಿಫ್ರೆನ್ಸ್ ಟೈಲ್ಸ್ ಎಲ್ಲ ಗ್ರೀಸ್ ಇಲ್ಲ ಹಾಕಿಕೊಂಡ್ಬಿಟ್ಟು ಬಟ್
Hello. No, that's fine. No, please, please. Thank you, all of you, for I suppose kindly and consciously participating in this very useful panel discussion. And I suppose all of us are much more informative at the end of it. I didn't really want to have my face here. Anyway, I guess it's now our turn to thank the panelists that have put in quite a lot of hard work. And I'm aware, as I was there in these meetings, that that it's been many weeks of quite hard work. But not only them, but the support cast behind the scenes with Vani, Puneet, Charishma, Raji, and Manisha as well. So all of them have contributed quite a bit to make this a success. And we do have now some of the office bearers of Friends of India to just formally thank them. So Viji Sampath, the current president of Friends of India, is thanking Susan, our dietitian. And you can all virtually clap. And then I'd like to ask Vijay Narayan, who's the Governing Council member of Friends of India, to thank Sindhu for chairing this panel discussion. And finally, I'd like to ask Jaisim, one of the joint secretaries, to thank Nandini for her enlightening talk and helping us understand diabetes better. All right, so now that the formalities are done, and thank you all, we would really like you to continue to provide some feedback to let us know whether this format is what you would like, or whether you would like sort of other topics, and quite a few other topics have come up as well. The HPN team will meet to look at what else can be done next. At this stage, it's about once every couple of months that we hope to keep going in one format or another. So please send through your feedback. Please send through specific feedback with regards to what you found useful in this particular discussion as well. Finally, as we started, I think at this time of need, all of us should remember and all our thoughts and support to our friends and family back in India who are doing it really, really tough. And we do hope that the calamity that is stuck, India will pass soon. And from here, of course, all of us are feeling quite useless in terms of not being able to help directly. We are helping through how much ever technology allows in terms of phone contact and so on and so forth. And yet another way that HPN and Friends of India have been helping is by raising money directly for the efforts, and we are in contact with NGOs on the ground there. And I'm glad to say that the response has been really, really good so far. That we have had quite a few people chip in. So that initially our initial commitment to procuring a number of concentrators, oxygen concentrators that can help with those that don't need high flow oxygen or don't need ICU ventilator care, has commenced. And in addition, there are a number of oxygen um, uh, regulators that we've been able to procure as well. So these are in the next 2 or 3 days will reach the NGO on the ground that we are working with, and will then start saving lives. We will provide updates as it comes to hand, and we request all of you to help the people in distress in India as much as you can, and feel free to either contact HPN or any one of the Friends of India volunteers if you'd like to hear more. So with this, again, thank all of you for your very kind attention, and until we meet again, please take care, and all the best wishes to you and to your relatives and friends in India. Thank you.